I'm going to discuss now about the definition of stroke. As you can see in this screen, the definition of stroke has got 5 criteria. Out of these 4 and 5, either one of them along with the first 3 would give a complete definition of stroke or a complete diagnosis of stroke. So if we go into the detail, this is based on the WHO definition of the stroke. So it's a sudden onset. It is usually patient has got focal neurodeficit, and it is vascular in origin, and either symptom is lasting more than 24 hours or there is evidence of neuronal tissue damage irrespective of the duration of the symptom. Now if we go back to each and every symptom, stroke is usually sudden in onset, as there is a clot which is blocking the artery. If the arterial supply completely drops off, then the neuronal tissue start to defunct very quickly, and hence the symptom is quite sudden. And if there is rupture of the blood vessels, obviously as soon as the blood escapes and damage the neuronal tissue, the symptom usually develop pretty quickly. So that's why it's sudden in onset. But there are certain situations where it can have a staggering onset, sometime in posterior circulation stroke, or a stroke caused by the critical caused by the clot with critical carotid artery narrowing, sometime because they give small thrombus to begin with, which get dissolved, and subsequently there is a large thrombus which can block, that can present with a staggering onset as well. Why focal neurodeficit? First of all, what is focal neurodeficit? Focal neurodeficit is where the deficit is not in the whole of the body, or it is restricted to a part of the body. That's because the artery normally supply a segment of the brain, and it's usually strictly in one side of the midline. That's why the symptom is usually focal. But sometimes there are situations where the artery doesn't follow this rule. For example, if there is a basilar artery stroke, it can present as global deficit. Sometimes there is a single artery which supplies both the thalamus, so if it is affected, that can give rise to global deficit. Patients who had a large bleed, and if it causes raised intracranial pressure and the blood volume is very large, the symptom can present as global deficit. And last but not the least, if the patient has got stroke along with seizures, that can present as global deficit as well. So although most of the time is focal, these are the situation where it could be global, but that is not common. The third is it's vascular in origin. What do you mean by vascular in origin? First of all, it is important to understand when we say vascular in origin, it is a vascular problem which happens spontaneously. So for example, if somebody is hit on the head and if they have got damage of the blood vessels resulting in damage of the neuronal tissue, that won't be classified as stroke. On the contrary, it would be called as traumatic brain injury. And clinically, we determine if there is a vascular damage or not is by finding out whether they have got vascular risk factor. Obviously, in arterial stroke, it could be either ischemic or hemorrhagic, and depending on that, the vascular risk factor are slightly different, or there is only few common, but mostly they are different. And I am going to discuss the vascular risk factor in separate video, but remember, they usually have got the vascular risk factors. And last two important point where you need to have either of these criteria is usually the symptom lasting more than 24 hours, or if there is damage of the neuronal tissue demonstrated either mostly by the earliest what we can demonstrate by which we can demonstrate the neuronal tissue damage is by MRI with the WI. And if we demonstrate that even if the symptom has lasted less than 24 hours, that's what we will call a stroke. So In summary, these are the important point in stroke, and remember this is mainly to define the arterial stroke. The venous stroke, this definition doesn't apply, but venous stroke is extremely rare, much less common than the ischemic stroke. This definition is applicable to arterial stroke, and following are the criteria. Thank you.